I am a trans man living with HIV. That's going to be relevant for the rest of the sessions.
During the AIDS Conference 2024 in Munich, a monumental moment was captured. The first session on HIV and trans men, solely presented by trans masculine people.
I'm joined today by a fantastic panel. We are all members of the International Working Group on Trans Masculine People and HIV. The working group is coordinated by GATE, and we consist of 30 transmasculine activists, researchers, public health experts from 22 different countries across all global regions. And our aim is to improve the inclusion of trans men in the global HIV response as a vital step towards ending HIV as a health threat.
Why is this session so important?
At the moment, trans men are largely excluded from HIV prevention programming. This is a massive issue. We're also excluded from the research studies, from the data.
We go through the vicious cycle of not having the data to get the support that we need or the funding for research.
Huge budgets are out there, but too little of this reach the trans. Why are we left out of many programmings? I will still ask that question. There is a myth that trans men don't acquire HIV. Do we have green blood, or are we not human?
HIV has had a foothold in trans men and trans masculine communities for as long as HIV has been around.
Are trans men more vulnerable to HIV?
The data that we do have shows that trans men have 3 times the risk of the general population. Just to take one country example, a 2023 study from Zimbabwe that was looking at various communities involved in sex work found prevalence levels of 38.4% amongst trans men sex workers in Zimbabwe. We have a whole lot of intersecting identities. We're also men who have sex with men. We are also sex workers. We are also people who use drugs.
When we are forced to live on the margins of society due to discriminatory laws and policies, we are more likely to engage in risky behaviors in order to survive. Engaging in sex work, substance abuse.
Part of vulnerability for trans masculine folks is sexual violence. Every study that has ever been conducted on sexual violence in trans communities has found that at least 1 in every 2 transmasculine persons has been subjected to sexual violence.
What other problems do trans men face in this context?
When trans men go to the health facilities, we are always asked transphobic questions like, are you a man or woman? We end up doing self-medication, which is too dangerous to our lives.
Trans men's sexuality has been assumed to be heterosexual, and there's actually been a good deal of hostility among trans men and trans masculine communities towards gay and bisexual trans men.
This was one of the most amazing things I've seen in my life, so thank you so much for being here. I have a question. A lot of trans men who are gay somehow try to validate their homosexuality by having unsafe sex as a way to show their masculinity.
There's sort of a hyper-invisibilization, but there's also active aggression from cis gay men towards trans gay and bisexual men that increases the difficulty and puts trans gay and bisexual men in a position of needing to make riskier decisions just to be able to be validated in their own communities.
The UNAIDS motto this past couple of years have been include the communities better, reach out to the communities better. And what we've seen is that the communities are always left on the sidelines, and that our work is always a little bit on the shadows and severely underfunded.
So how can we start to fight against these problems?
We must work towards creating a more inclusive and supportive environment that respects the rights, dignity of all individuals, regardless of their gender identity.
We are not just numbers, because who can talk better about trans people if it's not trans people ourselves? And we need to implement healthcare worker education and training to establish competence in providing HIV prevention, testing, treatment, and care to trans men and gender diverse persons assigned female at birth.
I live with HIV, and this shouldn't be something that is anything other than a status. Peer work is extremely important. Being visible in this situation is important because otherwise there's no way to reach out people who may be leaving the same situations. Once we understand our community, we can see each other and we can kind of support each other, stigma starts alleviating, and you build community and you build support, and you see yourself reflecting in someone else's reality, and then you feel like I am not alone in this fight.
We need the resources to be able to do the work, to pay for spaces, to pay for food, to pay for people to have the psychosocial support that they need, and to pay for facilitators to hold a safer space, because there's a clear and quite present danger that if we're unable to create the space where we can talk about this, an epidemic that is losing funding and losing attention is going to flare in our communities, and we will sort of disappear on the sidelines.
We have developed a policy brief. It's the first comprehensive document that makes the case for why we need to include trans men in the HIV response if we are really serious about meeting our global targets.
Download the policy brief on gate.ngo and help include trans men in the conversations about HIV.